of today we want to look at the shoulder joint. So as far as the upper limb is concerned, the shoulder joint is very important. Now we know the shoulder joint, generally we will call it the glenohumeral joint. It is a ball and socket joint. In fact, it is a synovial joint. If it is a synovial joint, then we know that we're going to secrete some. You have a joint capsule, which internally will have the synovial membrane. And this synovial membrane is actually going to lubricate the joint so that we can minimize friction. Now, apart from the synovial membrane secreting synovial fluid, we also have some fluid filled sacs known as bursae, and these bursae also minimize friction, reducing restrictions to movement at the shoulder joint. Now we have some of them shown in this model that I'm going to use, and it is named based on its location. Now you can see that this is the acromion because it's coming from the spine, acromion, and below it we have one fluid filled sac known as bursa, and this is because it's found below the acromion. We call it subacromial bursa. Subacromial bursa. Yes, we also have another one here, and this one we find it below the coracoid process, and therefore we call it subcoracoid bursa. Subcoracoid bursa. Yes, we also have subscapular and other ones, but for now these are those ones we can see. Apart from these, we also have what we call tendon sheets. Tendon sheets. For instance, you can see this tendon sheet, which actually surrounds the long head, the tendon of the long head or bicep brachii muscle, trying to reduce friction at where it runs through the intertubercular sulcus or the bicipital sulcus. So in fact, that is the shoulder joint. But this shoulder joint generally, inherently, it comes with great mobility. And what could be the reason for this great mobility? Yes, because the humerus, the head of the humerus is larger than the glenoid cavity of the scapula. And actually the glenoid cavity, because of its shallow nature, is deepened by a fibrocartilaginous rim, which is known as glenoid labrum. Now, yes, it is a synovial joint, very mobile. In fact, it's a multi-axial synovial joint, permitting such as flexion at the shoulder, extension, lateral rotation, internal rotation, subduction, and then rotation, among others. It's very mobile, but its mobility could come with some instability. Therefore, what are the elements that this structure, the shoulder joint, possesses to help in the stability of the joint? So notably, we want to look at them. Mainly we have some muscles as well as some ligament. Now the muscles are known as what we call the rotator cuff or the steering muscles. They steer the humerus either medial steering or lateral steering of the humerus. Now simply, the mnemonic sits muscle, the rotator cuff muscles are the sits muscle, SITS muscles. And so let me show you the rotator cuff muscles. Now, this is the first one, S, supraspinatus muscle, supraspinatus muscle. This supraspinatus muscle from the spinous fossa will insert in the greater tubercle of the humerus. Now, this muscle is actually for initiation of abduction, taking it away from the body, abduction, and it's for the 0 to 15 degrees abduction. It's actually supplied by what we call the suprascapular nerve, And what of the 15 to 90 degrees abduction? And that one is by the middle fibers of the deltoid muscle. The middle fibers of the deltoid muscle will help in the 15 to 90 degrees abduction. And beyond that, more than 90 degrees, taking it high up, will be by the trapezius muscle and the serratus anterior muscle. The next rotator cuff muscle that we find, finds attachment from the spinal fossa, the infraspinatus muscle, and is set again in the greater tubercle of the humerus. And that muscle, just like the supraspinatus, is also supplied by the suprascapular nerve. Yes. Now, apart from this muscle, we have a teres minor. Yes, not shown here, but we know that the teres minor is more related to the axilla, therefore it's supplied by the axillary nerve. Now, the teres minor, because of its insertion to the greater tubercle, the greater tubercle is laterally placed because of its location is for lateral rotation or external rotation at the shoulder joint. Now, the next one is the subscapularis muscle. It's not shown here, but the subscapularis muscle will find attachment, origin from the subscapular fossa, but this time around we insert into the lesser tubercle of the humerus. And we know because of the orientation of the lesser tubercle, its anterior place is for medial or internal rotation at the shoulder joint. Yes, apart from these rotator cuff muscles, where if there is injury to it, could result in instability of this joint, there are also some ligaments which help in stability of this joint. I want to mention some of them. One of the ligaments, they are named based on the attachment that we find. This time around, we have the acromion, and this is the clavicle, the lateral end of the clavicle. The ligament will be acromioclavicular ligament. Yes, apart from that, there will be another, which is this time around connecting the acromion process to the coracoid process, and this is known as acromio-coracoid ligament or coraco-acromial ligament. Yes, even apart from that, if you look deeper, if you look inside, there is another ligament, this time around connecting the coracoid process to the greater tubercle of the humerus, and that one you can call it humeral-coracoid ligament or coraco-humeral ligament. That one is also conferring stability to the joint. Well, apart from that, we also have this muscle, this ligament, this time around this ligament, connecting the lateral end of the clavicle to the acromion, and therefore we call it acromioclavicular ligament. But this acromioclavicular ligament is actually there are two ligaments making this up. One having attachment from the conoid tubercle, and therefore we call it conoid ligament, and the other one known as trapezoid ligament, trapezium in shape or trapezoid in shape, trapezoid ligament. Yes, apart from this, there is another ligament, spanning from the greater tubercle to the lesser tubercle, stabilizing the content of this intertubercular sulcus, and that one is known as transverse humeral ligament. And this transverse humeral ligament, is going to stabilize the content, as I say, the tendon of the long head of bicep brachii, as well as its synovial sheath, But again, in addition, which we'll look at in later, is the ascending branch of the anterior circumflex humeral artery. Yes, someone will be asking, what is this? I mean, this is actually the teres major muscle, And so the shoulder, joints, it is very, mobile, has flexibility as far as movement is concerned. But these muscles, rotator cuff muscles, as well as these ligaments, are able to help stabilize these joints very well. But let me just talk about this, which I think we forgot to talk about, which we said that the subscapular, muscle is actually supplied by the superior and inferior subscapular, nerves. Okay, ladies and gentlemen, this is the end of this tutorial. Thank you.